Hey guys, thank you again for letting me talk more. I like that. Also, thanks again for your attention. I'm going to try to make this not too terribly boring. I know it's getting towards the end, so bear with me a little bit. So, infection rate between peel pouch instrumentation and traditional means sterilization. So, not just in spine surgery, but in all surgery, infection is a dreaded complication. And we try to do, we take countless measures to decrease this at every turn. So, in spine, it's typically attributed to direct inoculation during the procedure or hematologist seeding early afterwards. And we've looked at this kind of at length, and we found that infections increase with the use of instrumentation, multi-level surgery, prolonged surgical times, open procedures, and obviously multiple medical comorbidities, which makes sense. You have to maintain a high index of suspicion to catch these infections and catch them early, and when that happens, aggressive intervention is often needed. But to kind of part from our joint colleagues, in contrast to these other disciplines in spine, we tend to keep our hardware if at all possible. Now, it's a significant mental, physical, and financial burden on both the surgeon and the patient when an infection occurs. And so, like I said, attempts have been made to decrease this. Now, one of these efforts has been trying to alter the way that we sterilize instruments. So you can kind of break it down into three general methods. One is rigid container, so that's like the metal trays and everything, like screws and rods and stuff come in. There are woven and non-woven material wrappers, which you'll typically see if for one-off kind of special use instruments, and then paper plastic or Tyvek plastic peel pouches, which you see used for various causes. Now, the use of reprocessed implants has been called into question, given the majority of manufacturers supply non-sterile implant trays to the hospital, and that comes into play a little later in the discussion. So this is just an example of each. So trays down there at the bottom right, non-woven material wrapper on the bottom left, and the peel pack at the top. So we wanted to see whether or not using the peel pack instrumentation decreased our rate of infection versus standard means. So we wanted to see if there was a difference in the rate of infection, but primarily use that information to guide decision making in the future, and perhaps do cost analysis with regards to peel pouch versus standard means sterilization, whether or not it's worth the extra time and effort and money that it's needed to do the peel pack stuff. And our hypothesis was that the peel pouch was more effective. found that they're not really, there's no different, but what we need to do going forward is we just need to gather more data. So this is, for an infection study, relatively low numbered, so it's underpowered. But what's going to be interesting, and this is something that was brought up when this project was taken to another meeting, was that doing the cost analysis is going to be probably very interesting for people that are paying attention to the cost analysis with the day-to-day operations of the operating room, and is probably going to be the most useful aspect of this study. Something I found after talking, though, was that trying to do the cost analysis of sterilization of a sterile tray of a set of screws is going to be very difficult, because the screws themselves are not able to be tracked, so you don't have any reliable way of collecting information on like how much or how many times one screw has been through a set of reprocessing. Does that weaken the implant to any significant degree due to corrosion or other factors? So kind of delving into those numbers is going to be difficult, but it's going to be where this study heads, and probably going to be the where we find the most utility in it. That's it. Thank you.